And we're back with pharmacist Dr. Heather Vance with Cone Health Community Pharmacy. So we're going to talk about some over-the-counter medications. All of us go to the drugstore and look for stuff to self-medicate for colds, allergies, whatever. When we go to those OTC meds and stuff like that, what should we keep in mind, especially if we have high blood pressure, diabetes, any other kind of chronic condition?
There are a lot of things to keep in mind. The first is that if you're ever unsure if a medication is safe for you, ask the pharmacist. We're definitely going to help you out with that. There are specific medications that need to be avoided in patients with high blood pressure, especially when it comes to things like Sudafed. So we want to avoid those, and not every medication is safe for everybody, especially for patients who have diabetes. It's important to note that a lot of our supplement products do have added sugar to them. So it's a lot of things to look at and think about when you're picking out your over-the-counter products. So it's really important to ask your pharmacist what may be best for you.
Yeah, and it's okay that you're not getting a prescription that day to ask them about something else that you're taking or with that.
Of course, yeah, you can always come to the consult window, the counter, and ask whatever questions you have.
Yeah, just because something is on the shelf doesn't mean that it's safe for you to take specifically. All right, so let's talk about over-the-counter medications that you recommend keeping on hand so we're ready if any of our guests that ever come over get sick.
Yes. Of course, like you had just said, not every medication on the shelf is perfect for everybody. So I would recommend a pain reliever medication, ibuprofen, Advil, things like that. But there are risks for those, as well as a medication maybe for a fever like Tylenol. We also have medications that can be used for upset stomach, Pepto-Bismol, Tums. I would recommend keeping those on hand. And then especially now in our allergy season, we carry all products like Allegra, cetirizine, Zyrtec, things like that that are going to be used every day as you need them for symptoms related to allergies.
Yeah, that it's hitting everybody hard, that is for sure. All right, speaking of medicine cabinets, how do we store medicine? Because we've had some debate, I've had some debates with a few friends just in the last 24 hours about where you're supposed to store things.
Surprisingly, to a lot of people, you are not supposed to store your medications in the medicine cabinet in your bathroom. Medications need to be kept in a cool, dry place, and the bathroom is not that place, even if it is in a cabinet in your bathroom. I really would recommend keeping them out of reach of children and pets. The best place is often a kitchen cabinet, and it's a place that you frequent, so it's easier to remember to go and open that cabinet and take your medications. So I would really recommend that, or somewhere else away from children and pets that you have good airflow and there's not going to be that heat and moisture.
Okay, gotcha. Another key thing for long-term wellness, staying up to date on vaccinations, even as adults. So what advice do you have for that?
I recommend reaching out to your pharmacist if you ever have any questions. If you're not up to date on your vaccinations, we offer a host of vaccinations on all of our sites. So you can visit us at conehealth.com/community pharmacy, and that's going to tell you all about our vaccination policies and what medications we carry. But if you ever are wondering, you hear about a vaccine on the news and you don't know if you need it or you had it, we can always look on our North Carolina immunization registry, see what you are eligible for. So it's another one of those situations to ask the pharmacist, but the best way to keep up is to make sure that you're regularly in contact with a healthcare provider.
Okay, and we've got like about a minute or so left. Just to kind of wrap up what we've been talking
Yeah.
about, final thoughts on how the pharmacy team really is a vital part of our healthcare.
Yeah, pharmacists are there to support patients in achieving their healthcare goals beyond just picking up your medication. We want to support you through that process. If you ever need something like getting a CGM for diabetes installed, if you need to ask a question about a vaccine, or if a over-the-counter product is safe for you, we're there. We're a part of your healthcare team. And we'll also reach out to your providers if we're worried about you. So if there's anything, you come and see us and we're worried that you may need some more support, we are more than willing to help you through that, and we will reach out to our teams. We also offer a lot of patient access support. So if you're struggling with the cost of medications, we try to be the most affordable we can be for you. We find discounts, we sign you up for patient assistance programs, and things like that that often aren't thought about as part of your healthcare journey, like access, transportation. We're there to help you solve.
Fantastic. All right. Thank you so much for your time and expertise. If you missed this, maybe you need to send it to someone. It's going to be in the To Your Well-Being section of our website.